Hi, my name is Haley Purefoy. I'm a clinical director with Oculus Health. I think starting as a PA, I was able to really see how we can make a difference in patients' lives from the very front end of it. And becoming a clinical director, I'm now able to help direct other PAs and what I feel to be able to make the most difference in patients' life and be able to significantly change the outcome of some of their health conditions.
My name is Toy Keeler, and I'm a patient advocate at Oculus Health. I have been in the medical field since 2007, and I've always been in an office of some type. I am a certified medical assistant as well as a phlebotomist, and I love the patient contact. And I feel like that even though I'm not face-to-face with these patients, that I know I make a difference in their lives. I know that on some, not with every patient we touch, but with at least half the patients that we touch, you hear their appreciation in their voices, you hear their thank yous on a daily basis, and I still feel like I'm able to contribute and make a difference in someone's life, even though it's telephonic and not face-to-face.
My name is Patrick Sullivan. I work for Oculus Health. I'm a patient advocate. I love just the title itself, patient advocate, being an advocate for that patient, being there for that patient with their needs, whatever they need, anything I can do to help somebody, anything I can do to, change their life or, lifestyle, that's what I'm there for.
So I got into the healthcare industry because my want to make a difference. And even though we work in remote positions and we do telehealth and we do it all by the phone, teletriage, you start to build this rapport with patients and you learn them and you learn about their families and you learn about their children and their dogs. And even though you're not face to face, you actually build relationships with these patients and you know that you're making a difference and they give you that feedback that you're making a difference. And sometimes all a patient needs is to talk to somebody, and if that's who we need to be for them at the time, then that's who we are, and we do whatever we can to make their concerns our concerns and try to make a difference in their lives.
I've been in healthcare pretty much all my career. I've been doing it for about 7-8 years now. I've worked in all types of practice. Internal medicine is my main experience. Also sleep medicine as well. But when I was working inside practices, there was something that was missing. I didn't feel like I was helping enough, or I was getting that feel, that I was actually helping patients. Just being there for patients, interacting with patients, helping them with whatever they need. Anything I can do to help a patient or, change their lifestyle or just help them in any way, that's what I'm there for. That's my purpose.
Since I've been working here with Oculus, I've learned that not only do we provide a sense of safety for our patients, but we also give them the dignity that they deserve. We build the rapport and the trust with them, and once we go over our medical questions that we have to have, they also are free to talk about, they feel comfortable enough after a certain length of time that they open up to us about their personal life.
To me, the biggest impact that I've ever felt like I've made with a patient is I called a patient for a routine monthly call, and she didn't sound like she was doing okay. She kept hollering and yelling for help and then asked me to leave her alone. And this wasn't her normal behavior. And I tried to get her to talk to me for a little while, and she just was not receptive. So I could tell that that she needed help, and so I went ahead and dialed the emergency service line for this patient in that area and ended up talking to the patient the next day, and she asked if I was the person that called 911 for her, and I told her yes, and she said thank you so much that I possibly saved her life. She had taken a medication that interacted with another medication, and she didn't know who she was or where she was, so making a difference like that, I feel like is something that I'll always remember.
He told me that he had this issue with his son is a car salesman, works 60 hours a week, and it was really inconvenient for his son to come over and help him twice a week. And if I could find someone, he said he had checked with the veterans, like at the Veterans Hospital, and everyone kept telling him he wasn't qualified for any programs. And so I called the area agency on aging and was able to get a hold of someone that told me that he would be because of his age and his chronic management, his chronic problems.
So she wasn't eating too much during the day. She was only eating like a meal a day at most. Wasn't eating too healthy because the local food pantry she went to didn't have a lot of options. So I offered, to help get her set up with Meals on Wheels. And she was kind of hesitant at first because she thought it costs, but I told her, it's completely free, and then, they'll provide you at least 2 to 3 meals a day, and they're healthy meals, They're good, healthy options, and you'll be getting, all the essential food groups and everything. So she was interested in that. So I called, and I got it set up, I got it arranged. They contacted her. I kept in contact with them to make sure that they had contacted her and they got her set up. So when I followed up with the patient, she said, they're going to come out to get me set up. They're actually also going to have somebody come out and help me with some light house cleaning duties as well. So she said, that made a big impact in her life, being able to have that, and she thanked me for it. So when I first heard about Oculus and what the position entailed, I got excited about it because it sounded different than what I was doing, and it sounded more like I was, really getting engaged in a patient's life and helping them. And from doing it, how long I've been doing it, I really feel that I've been doing that. I really feel that I'm making a difference in somebody's life and helping them any way I can. That's what I'm there for, is to, be there for a patient. Any support they need, if they need a health coach or coach them to do anything, I'm gonna be there, I'm gonna do that. If they wanna have certain goals set and they wanna meet those goals, I'm gonna help them meet those goals, because that's what I'm there for. That's what I feel like, it's my job to do that, and I'm going to do it any way I can.
I've also learned that by working with Oculus that we not only provide safety measures, we also provide dignity, where I think sometimes it's easier to talk to someone over the phone versus face-to-face about some very personal issues. So I feel like that Oculus makes a difference not only with dignity but also with their own self-image.
I think an extra reward working with Oculus Health is being able to step away at the end of the day, and it wasn't just about numbers or what you made or the production. It was that you did what you could that day to actually try to make a difference in somebody else's life. Not only one person, but we try to capture many patients every day and do what we can and work as a team, and we know that we feel like a family here at Oculus.